Good afternoon, and welcome to today's webinar on the economic recovery and the nursing labor market in California. Today's presenters are myself, Joanne Spetz. I'm a professor at the Philip R. Lee Institute for Health Policy Studies at the University of California, San Francisco. We also have with us today Terry Hollingsworth, Vice President of Human Resources Services at the Hospital Association of Southern California, and Judy Berg, the Executive Director of the California Institute for Nursing and Healthcare. The goals for this webinar are to learn how Chief Nursing Officers perceive the current RN labor market, to track the latest hospital vacancy and turnover data, to understand how recently graduated nurses are faring, to measure the impact of enrollment trends on forecasts of future supply, examine new estimates of future demand, and identify the next steps for ensuring an adequate nurse supply in California. This work results from a collaboration of multiple organizations. The Betty Irene Moore Nursing Initiative has supported this research now for several years. Our work is in collaboration between UCSF, the California Institute for Nursing and Healthcare, and the Hospital Association of Southern California. We'd also like to give acknowledgement to the California Hospital Association, the Hospital Council of Northern and Central California, Future Sense Incorporated, the Hospital Association of San Diego and Empirical Counties, and UCSF staff and interns Timothy Bates, Leela Chu, Jessica Lynn, Dennis Keene, and Ann Reed. So what is going on in the RN labor market in California? We've had reports of nursing surpluses since about 2009 when the recession began. There have been newspaper stories of new graduates who are unemployed. There has been a real sense that the demand for registered nurses dropped due to the recession for two reasons. First, there was the decline in health insurance coverage. With the recession, many people lost their jobs and then had no more health insurance. And it's very well established that when people have no health insurance, they tend to demand less health care. When there's less need for health care, there's also less demand for the people who provide that care, such as registered nurses. So there was this lower use of services that was driving demand downward. At the same time, the supply of registered nurses has increased notably in California over the past 10 years, as well as in the rest of the United States. We've had substantial growth in RN education programs, more than doubling over a decade. So when you have this kind of increase in supply while demand is dropping, you can definitely have a scenario in which, at least in the short term, people find it very challenging to get a job. The question right now is the economic recovery changing this situation, and what will the future hold for the RN labor market? So let's talk about how chief nursing officers are perceiving the current labor market. We've conducted a survey of chief nursing officers for several years now. This has been fielded by UCSF with support from the Gordon and Betty Moore Foundation. This is a web-based survey with the option for respondents to return the survey by fax or email. The questions are based on previous surveys conducted by the California Institute for Nursing and Healthcare, also called SINC, and the National Forum of State Nursing Workforce Centers. They've made recommendations for minimum data set elements for demand-related data. We've conducted 6 surveys thus far, in the fall of 2010, 11, 12, and 13, and then we conducted short spring surveys in 2011 and 2012. These are the top-level results of this year's survey as well as the prior year's surveys. The perceptions of employers of the overall labor market have really shifted over time. In 2010, you'll see that the blue shades are those who indicated that they felt that the demand was less than the supply of nurses available. And the red indicates that there was a high demand for nurses and that it was difficult to fill open positions. In 2010, nearly half of hospitals indicated that they thought that the demand was less than supply available, and only about 35% felt like there was some difficulty filling open positions, or in general that it was difficult to fill open positions. That would indicate overall that in 2010 there was probably primarily a surplus of nurses in the state. Over time, between 2011 and then to 2012, you can see that the situation changed, so that by 2012, only about 29% of respondents felt that there was less demand than supply. Between 2012 and 2013, however, this seems to have backtracked a little bit. So now we have about 40% of hospitals indicating that they thought that demand was less than supply in 2013, and a very similar share thought that there was more demand than supply. About 19% were in the middle, feeling that their local market was fairly balanced. There's a lot of regional variation in these numbers. These data here represent the average scores from the data presented previously. A higher number indicates more shortage, so a 5 would indicate that the demand is substantially greater than the supply, and a 1 would indicate that the demand was substantially lower than the supply. So a balanced labor market would have an average score of 3. You can see for California statewide in 2013 that the average was 2.95, so that's pretty close to a balanced labor market across the state. But there's a lot of variation. In the San Francisco Bay Area, the average score was 1.9, indicating that overall demand is less than supply. In other regions, such as in the Inland Empire and the Sacramento and Northern California regions, there is an overall sense that the demand was somewhat greater than the supply. None of the regions in 2013 reached a score of 4, indicating that there'd be a pretty strong consensus that there was a greater level of demand than supply. We also compared new graduates versus experienced registered nurses. As you can see in this slide, there are some notable differences between the RN graduate labor market for those who graduated within the past year or so and nurses with more experience. The short story is that in every market of California, experienced RNs are in much more demand than new graduates. And in fact, in every region of California, the demand for new graduates is really much less than supply, with an average score of less than 2. In almost every market of California, the average demand for experienced nurses is much greater than supply, with an average score of at least 3.8 or greater, with the exception of the San Francisco Bay Area, where the average score even for experienced nurses is only 2.71. So in the San Francisco Bay Area, it appears that the supply of nurses for both experienced and new graduate nurses is much greater than the demand for those nurses. But in almost every other region of the state, there is a notable demand for experienced nurses and very soft demand for new graduates. There's also variation between rural and urban regions of the state, and this pattern has been consistent across all 4 years of this survey that we've conducted thus far. In rural areas, the demand for nurses is notably higher than the supply on average, and in non-rural areas, in general, the labor markets tend to be more balanced or perhaps have a little bit too much supply. There are also differences by the sizes of hospitals. In general, smaller hospitals are more likely to report that they have some shortage of nurses, especially those hospitals under 200 beds. Hospitals that are larger are somewhat more likely to report that they have more supply available than demand for nurses. We asked respondents to tell us what their perception was in the change in the difficulty of recruiting nurses compared to the prior year. In fall 2013, you can see that there's a lot of variation by the job titles of nurses. The orange color indicates that the respondent felt that it was more difficult to recruit nurses than in the prior year, and the blue indicates that it was less difficult. As you can see here, somewhat more chief nursing officers felt that it was somewhat less difficult to recruit staff registered nurses than in the prior year, and only about 14% felt like it was more difficult. 2/3 thought the labor market was about the same. For other nurse job titles, which would include case managers, utilization review, infection control, and other kinds of non-staff RN roles, 40% of nurses, or nearly 40% of chief nursing officers, indicated that they thought it was more difficult to recruit into those job titles than it had been a year prior, and about half thought the labor market was the same. Only 9% thought it was less difficult. Chief nursing officers also, in general, thought it was less difficult to recruit licensed vocational nurses, nursing aides and assistants, certified nurse midwives, nurse anesthetists, and it was more difficult to recruit nurse practitioners and clinical nurse specialists. We asked nurse employers in the next slide to indicate the change in employment in the past year. You can see that for most job titles, there has been an increase in employment between 2012 and 2013, as reported by chief nursing officers. The blue shades indicate higher employment compared to the prior year, and the orange indicates that the CNO said that they had decreased their employment. There were more respondents who indicated increased employment than decreased for staff RN jobs, other RN roles, new RN graduates, nurse practitioners, and clinical nurse specialists. There was a decrease in employment, or more CNOs indicated a decrease in employment than indicated an increase for nurse anesthetists, nurse midwives, aides and assistants, licensed vocational nurses. These data are very consistent with the prior slide that indicated the change in difficulty recruiting. There's a high correlation between the change in employment and the change in the difficulty recruiting, where those jobs for which more CNOs indicated that there was an increase in employment, those were the same jobs where it was also more difficult to recruit. We asked CNOs if there had been changes in employment in the past year, what the reasons for those changes were. These are the most common responses. The most common response was that there was a budget constraint, that the budget constraint may have reduced hiring, or if the budget constraint were loosened, that it enabled an increase in hiring. The second most common response was a reduction in the patient census, which in general would have necessitated less hiring of nurses. Increases in patient acuity was the third most common response, which probably led to increases in employment of nurses, especially nurses in the other nurse roles and clinical nurse specialists. Some employers also indicated that they experienced current staff working more hours, thus they didn't need to hire as many nurses, and that there were fewer nurses retiring. We asked CNOs specifically about the hiring of newly graduated nurses between 2010 and 2013. And as you can see, over time, there has been a decline in the share of CNOs indicated that they had hired newly graduated RNs in the prior year. There also had been an increase in the share who said that they never hire newly graduated RNs. This suggests that with the labor market being in a situation where there is generally more supply than demand for newly graduated RNs, that employers have been relying more on experienced nurses in their hiring plans. We asked chief nursing officers about their hiring requirements and preferences. These data indicate the results from 2011, 2012, and 2013. In 2013, only 12.4% of CNO respondents indicated that there were no experience requirements for their newly hired nurses. Over half in every year indicated that there was a specific type of experience required, most oftenly reported to be critical care, the operating room, the emergency department, or labor and delivery. In 2013, about 72% indicated that they preferred a bachelor's degree, and 8.2% indicated they required a bachelor's degree. These are increases over the prior years. And in 2013, about 64% of CNOs indicated that they had a minimum experience requirement for new hiring. CNOs were asked about their plans regarding hiring BSN-educated nurses. The responses are indicated here that about 2/3 indicated they plan to increase the share of nurses with a baccalaureate degree, and 36% had a specific target percentage in mind, with most indicating that that target percentage was to have more than 75% of their workforce be baccalaureate educated. 11.1% require that newly hired registered nurses obtain a baccalaureate degree within a certain time frame if they don't already have one when they're hired, and 52% require a bachelor's degree for promotion beyond the staff nurse job title. CNOs were asked what barriers they faced in increasing the share of nurses with a bachelor's degree. The most common responses were that they had a lack of funds to provide financial incentives to their employees to get a bachelor's degree. There was a lack of tuition reimbursement funds. There was a low supply of bachelor's educated nurses in the community, and a lack of bachelor's education programs in the community. CNOs were asked about the new graduate training programs that they might offer for newly graduated nurses. 55% of respondents indicated they had a residency of some sort in 2013. We are not able in these data to distinguish between residencies designed for people who may or may not be employed by the hospital and residency or transition programs for people who have been hired by the hospital. About 80% of respondents indicated that their program had been developed internally, with the most common capacity being 40 to 80 graduates at a time. The most common length of these programs was about 12 weeks. Overall hiring expectations for the next year were another topic of request from these surveys. As you can see in the 2013-2014 time period, more CNO respondents indicated they plan to hire more than last year than said they plan to hire fewer. Specifically, only about 15% said they expect to hire fewer nurses than the prior year, and about 35% said they plan to hire more nurses than the prior year. About half of respondents expected no change. These numbers show somewhat of an improvement prior to the previous years in terms of the share of CNOs who expect hiring to increase for next year. CNOs who are expecting greater employment over the next year were asked the reasons they anticipate this to be the case. The most common response by far was that they anticipate an increase in patient census. Other commonly stated reasons were that they anticipated an increase in patient acuity, a care model redesign was underway, and they increased their bed capacity. You can see that there are a variety of other reasons that employers expect to hire more nurses over the next year, indicated here. Employers were also asked if they had indicated they expected lower employment, the reasons that they would anticipate less employment over the next year. The most common response was that they anticipated a reduction in their patient census. Budget constraints, hiring freezes were also very commonly reported, as was the report that they had just been having less turnover of their nurses, so they expected there to be less job openings. The hiring expectations for newly graduated nurses were another question in the CNO survey. 24% of CNOs in 2013 indicated that they expected to increase their hiring of newly graduated nurses over the next year, which is an increase in the share reporting this compared to 2011 and 2012. About 15% indicated that they expected to decrease their hiring of new graduates, and about 61% indicated they anticipated no change. These data suggest that there might be some improvement in the hiring prospects for new graduates over the next year. So now I'd like to turn over the presentation to Terry Hollingsworth to talk about the latest hospital and vacancy and turnover data that's collected by the Hospital Association of Southern California.
In the fall of 2013, 171 hospitals participated in the Healthcare Workforce Survey. Today I'll be presenting to you highlights of the report. In this first slide, it shows a year-to-year comparison of turnover by nursing category. Staff RN, with the staff RN category, we're seeing a slight decrease in turnover from 2.5% in 2012 to 2.3% in 2013. The other RN category, which is defined as registered nurses who are not staff RNs. An example of this would include managers and other registered nurses who do not provide direct patient care. We're seeing an increase in turnover from 2.4% in 2012 to 3.4% in 2013. As for the LVN and unlicensed aides and assistants category, we see a decrease in turnover rates for these two categories. So with this 2 years of data and the implementation of the Affordable Care Act, it's going to be interesting to see what trends develop over time as we move forward. The challenge for all hospitals is to re-examine their care delivery model and implement efficiencies across the board. In doing so, it may be that some frontline managers may be asked to do more with less. In addition, we may see LVNs and aides being utilized differently in the acute care model as well as in other outpatient settings. Next slide, please. The second slide shows the year-over-year comparison of hiring practices by nursing category. In all four categories, we've noticed an increase in hiring among our member hospitals. The most notable is the LVN category. Again, this trend, as I mentioned previously, might suggest that the LVNs are finding opportunities within the acute care setting as well as outside of the four walls of the hospital, more so in a clinic and ambulatory care setting. Next slide, please. This next slide shows the hiring practices of new graduates. And we're noticing here that in 2003, we're seeing an increase in the hiring of part-time new graduates. That's most notable from 6.6% in 2012 to 15% in 2013. We're going to monitor this trend over time, but this might suggest that hospitals are looking for the best and most cost-efficient model that provides staffing flexibility by utilizing part-time new graduates. Next slide, please. The fourth slide provides us with RN vacancy information here. And in 2013, we see the vacancy rate at 4.2%. For the most part, over the past 4 years, the trend has been somewhat steady, no major increases or decreases. But again, we're learning that hospitals across the state are being challenged with hiring specialty RNs, and that could be what's showing up in the 2013 4.2% rate. We received calls here at the association indicating that hospitals are experiencing challenges with hiring with labor and delivery nurses, OR nurses, and that could be what's showing up in the 4.2% in 2013. Next slide, please. And then our last slide is a different perspective of vacancy rates by part-time and full-time categories here. And again, this is another perspective on nursing categories, and most notable would be the new graduates and the aide part-time categories, which might suggest again that hospitals are using this strategy to provide flexibility and economic efficiencies within their organization by utilizing the part-time categories versus full-time.
Good afternoon, everybody. It is a pleasure to be part of this collaborative webinar and present data from a statewide survey of new grads conducted in the fall of 2013. This is a survey that has been conducted in the fall of each of the last 4 years that provides data from newly graduated, newly licensed registered nurses in the state of California to tell us how they're faring relative to employment in the state. And I want to particularly note and thank our funder for this particular survey. Funding has been provided by Kaiser Permanente Fund for Health Education at the East Bay Community Foundation, both in 2013 and each of the previous 3 years as well, which we certainly appreciate. This survey is also a collaboration, so we're talking about a collaboration within a collaboration here. And our partners in this work are the UCLA School of Nursing, the California Board of Registered Nursing, the Association of California Nurse Leaders, and the California Student Nurses Association. This is a survey that goes to 50% of the newly licensed registered nurses in California between September 2012 and August 2013. Each one of the newly licensed nurses in that 12-month period of time receive a letter from the Executive Director of the Board of Registered Nursing inviting them to a website to take an online survey giving feedback about their employment experience since they became licensed. Next slide, please. In our survey, we found that 59.3% of the newly licensed graduates were in fact employed as a registered nurse, up 54% from last year, which we are taking as a cautiously optimistic sign that employment opportunities for new graduates are in fact improving. You'll see that in 2010, 11, and 12, the employment was holding at 57%. So up a little bit over the last 4 or 5 years. Now, as Joanne noted earlier, there are some differences in terms of full-time and part-time employment. And our respondents indicated that 77% of them had found full-time employment, while 14% were employed part-time and 8% were per diem. As a national comparison, just of interest, the National Student Nursing Association also does an annual national survey. And they found in their survey in 2013, roughly the same collection period, that 86% of new graduates nationally were working full-time, 11% were part-time. We also just wanted to compare very briefly with the 2012-13 BRN Annual Schools Report, and I think Joanne's going to be talking a little bit more about that later. But the estimate of the deans and directors were that 76% of new graduates were employed as a registered nurse. However, just under 64% of them were employed as RNs in California. So it's a little bit more than a 4% difference than the findings in our survey itself, with, of course, 18.3 unable to find employment. And the difference between the percentage employed as a registered nurse and the percentage employed as a registered nurse in California probably relates to the out-migration of new graduates from California into areas where there are more opportunities to find employment as a registered nurse. Next slide, please. It's a relatively busy slide that compares new graduates' working experience last year as compared to this year by different regions in the state. And of course, we all know that California is a very, very large state, and the sub-regions within the state have very, very different experiences in multiple areas, including the employment of new graduates. And what we notice in this slide, if you look at the bars on the right side of the slide as compared to the left side of the slide, there is in general an uptick in hiring in most of the regions in the state. And in fact, Orange County, Inland area, Inland Empire area, Northern California, Central Valley, and Central Coast all experience higher levels of new graduate hiring than did the other parts of the state. In fact, one part of the state, there was less hiring, and that was the Sacramento area. So in general, as we noted earlier, the increase was a bump of about 5% throughout the state. But the biggest jump in employment happened in the Central Valley, which went from 67% in 2012 to 4 out of 5 new graduates finding employment in the Central Valley in the most recent survey. Next slide, please. We found that employment rates also vary by education, and in fact, this corroborates what Joanne was talking about in the CNO survey, and that difference in degree seems to be making more of a difference in this last year over the previous year. So in general, our survey found that 55% of associate degree graduates were finding employment, compared with 63% of baccalaureate-prepared new graduates and 67% of entry-level master's students. So as the graph shows, in 2012, there was only a 6% difference in hiring between an associate degree and an entry-level master's degree, whereas in 2013, that spread had expanded to 12%. That also is somewhat consistent, again, with the national picture, which has numbers that would also reflect a 12% spread between an associate degree graduate being hired and an entry-level master's being hired. The national data shows us that 72% of associate degree nurses nationally are being hired, compared with 84% with an entry-level master's and 81% with a baccalaureate degree in nursing. Next slide, please. We then ask about employment settings of new graduates and where are they getting those first jobs. The primary environment of practice remains hospitals, acute care hospitals, and you'll note that 58.6% of our new graduates are working in acute care hospitals. It is important to note, however, that that's a decrease from last year of about 7.5%. Last year, 66% of new graduates were getting their first job in acute care. So the increases have come in long-term care. Last year, that percentage was 11%. This year, it's a little bit over 13%. And then also in community-based settings. And those settings are broken out into home health, community behavioral, and corrections. And you'll see the varying percentages for those different settings. If you added those all together, they would be just under 13% for this year's survey, as compared with 8% in last year's survey. So there's a 5% growth there. Other remains about the same, but we're seeing a real shift in employment from acute care settings into more community-based settings. Next slide, please. For those who found jobs in this survey, we asked them how long it took to find that job, and noted that 46.6% were employed within 3 months compared to 53% last year. So it's taking a little bit longer to find those first jobs. Just under 62% were working in a job of choice compared to 65% last year, so a little shift in terms of those choice jobs. We talked earlier about how many are working full-time, and then we asked them also about how many are participating in transition to practice or residency programs, and that number was 26.6%, which is an increase over 20% from the previous year. So we were very pleased to see that over 1 in 4 of our new graduates are having the opportunity to participate in a transition to practice program. Next slide, please. We also asked the new graduates who were not yet employed what stumbling blocks they were finding in their job searches, and really no big changes in this list from last year to this year. And having no experience topped the list last year, it tops the list again this year, and of course presents that conundrum for new graduates of how do you get experience if you don't have experience, and that's a requirement. Over a third ran into the baccalaureate being preferred or required for a particular position. One that we saw this year for the very first time, and it's a very, very low number, but one that we want to continue to watch, is almost 1% ran into a problem with a low GPA, and that caused then to be issues around even being considered for employment. Next slide, please. We also ask new graduates who are unemployed, what are they doing? If they're not working, what kinds of things are they doing? And this graph is very, very similar to last year. There's no remarkable changes on this at all. New graduates, newly licensed nurses who are not employed are working in healthcare but not as registered nurses. They're also working in jobs often that they held before they were licensed. Some are volunteering. About the same percentage are continuing on with their education. And then there is our largest category, other, is just a huge bucket of things that are very specific kinds of volunteering, or they're going to school a little bit and they're continuing in a non-nursing job, combinations of the others, if you will. So I would invite you to view the entire report if you would like to. It's on our website, which is www.cinhc.org. Joanne, I'll turn it back to you.
Thank you, Judy. Now let's take a look at enrollment trends in California nursing schools and deans and directors' sense about what's happening in the labor market. Deans and directors are asked in the Board of Registered Nursing's annual school survey what share of their graduates are employed in each type of employment setting, as well as employed in California in general. The data are presented here. As you can see, in the 2012-2013 academic year, deans and directors in California estimated that about 73% of their graduates from the prior year were employed in California. About 56.7% of those graduates are employed in hospitals. This is an increase compared to the two prior academic years, but is still a notable decline compared to prior to the recession. In the 2008-2009 academic year, deans and directors estimated that over 83% of their graduates were employed in California. As you can see, California RN graduations per year have been increasing quite substantially since 2003-2004. In that academic year, there were just over 6,000 graduates per year, and in the past 4 years, there have been nearly 12,000 graduates per year. If this slide went back into earlier years, you'd see that the number of graduates has more than doubled over the past decade. This increase in supply has led to a notable change in the range of supply forecasts for California in the long term. As you can see from the Board of Registered Nursing forecasts that were published in 2013, the supply of RNs in California is expected to be fairly stable over the next 20 years, even though there are anticipated to be big numbers of nurses retiring as the baby boomers approach retirement age. The forecast of full-time equivalent RNs per 100,000 population also is fairly stable, with the projection that it might decrease slightly over the next 20 years, but remain much more stable than had been projected before there was so much growth in our RN education programs. So let's talk about some new estimates of the future demand for nurses and other health professionals in California. It's very challenging to estimate demand, to be honest. Employer surveys can tell us a lot about the current demand and what employers estimate the demand to be in the next 1 to 2 years ahead, but it's very difficult for employers to estimate what their demand will be much beyond that. They live in a very complex competitive environment. Their short-term demands are so substantial it makes it very hard for them sometimes to prepare for the longer-term needs, and their financial imperatives are very focused on a 1 to 2 year time horizon. They really are not in a position to think too far into the future because they have to make sure that they're financially solvent year after year in a rapidly changing environment. So how can we forecast demand if we think that employers are not going to be very helpful in doing so beyond 1 or 2 years? Well, one approach is that we can use national benchmarks. We often look at the number of employed RNs in California per 100,000 population and compare that to other states and the United States on average. California tends to be near the bottom of the number of employed RNs per 100,000 in the U.S., ranging between about number 47 and number 50 over the past decade or two. So it's very easy to argue that we might do better to increase so that perhaps we're at least at the 75th percentile, so that we might have maybe about be number 37 in the country instead of number 47 in the country. The U.S. Bureau of Labor Statistics estimates the total employment of RNs 10 years into the future, and their estimates come from a mix of supply and demand. So they're estimating employment, and then if there's a shortage, that employment might be curtailed due to a lack of supply, or if there's a surplus, then the demand is going to dominate the estimates they produce. We also can do forecasts from projected hospital utilization, focusing on the growth in patient days that are anticipated to arise due to population growth, and from that predict hospital RN demand. The details of that kind of modeling approach are presented in the Board of Registered Nursing Forecasting Report in 2013. And finally, we can do micro-simulation models, which I'll describe in more detail in a moment. The Board of Registered Nursing supply and demand forecasts for RNs are presented here. The supply forecast that I showed in a prior slide is the orange line, and then different estimates of future demand are presented in the other lines. The dashed line is the goal if we were to strive to achieve the national 25th percentile of FTE RNs per population, in other words, being ranked about 37th in the United States. The other dashed line that's parallel and above it is if we were striving for the national average. You can see that we are projected to be short of both of those numbers over the next 25 years or so. The more steeply sloped line that's in gray is if we estimate the growth in demand for nurses based on anticipated growth in patient days due to the aging of the population and population growth. And again, we're estimated to be somewhat short of that into the future. We also can take a microsimulation modeling approach, and this is an approach that I've been working on with my colleagues Bianca Frogner at George Washington University and Steve Parente at the University of Minnesota. In this approach, we're using a model that was developed by Dr. Parente called the Arcola model that estimates insurance coverage and health services demand. This model was built using employer and commercial insurer data. Using the Arcola model, we estimated the impact of the Affordable Care Act on the demand for healthcare services and then translated that into estimated demand for healthcare professionals. We then more recently worked with colleagues at UCLA to customize this model for California to align it with the California Health Interview Survey and other California-specific surveys, as well as the CalSIM forecasts that are developed at UCLA. This led us to produce both state-level and regional estimates focused on California. This graphic here maps out our estimation process. On the left, we basically blended the Arcola and the CalSIM models and customized them to California. We made assumptions about what insurance premium growth would be, and we assumed that the Affordable Care Act would unfold in California as it was legislated, which is a fair assumption since California has gone into full implementation of the Medi-Cal expansion as well as the health insurance exchanges. We then looked at the population by insurance type in 2013 and made assumptions about how the Affordable Care Act would lead to increases and changes in insurance enrollment by 2021. These led to estimates of the numbers of healthcare services that would be demanded by the newly insured, as well as people who are currently insured who changed their plans, and that then was translated into labor force demand. The projected number of new jobs by industry due to the Affordable Care Act is indicated here. As you can see, hospitals are projected to have the greatest number of new jobs in California due to the Affordable Care Act, which is not surprising since hospitals do account for most employment in the healthcare industry across the United States. Other healthcare services are expected to grow, as well as dentist offices, physician office demand, outpatient care centers, and nursing care facilities. There'll be somewhat less growth in jobs in all of the other settings we looked at over this time period. The forecasted new jobs due to the Affordable Care Act are really a drop in the bucket compared to the overall estimates of what new job growth will be in California. This is because, regardless of the Affordable Care Act, California is facing population growth and population aging, both of which are anticipated to increase the demand for healthcare workers. So for registered nurses, you can see that less than 10,000 of the new jobs expected due to the Affordable Care Act compares to about over 45,000 new jobs that is non-Affordable Care Act growth in nursing. So you can do similar estimates across all the different kinds of jobs, and in general you will find that the Affordable Care Act growth is less than the non-Affordable Care Act growth, with the exception of medical managers, dental hygienists, and dental assistants. So where will these new jobs be created? Well, the new jobs, not surprisingly, will be predominantly created in hospitals because most employment is in hospitals already. But as you can see, other healthcare service settings, which include certain kinds of ambulatory and laboratory settings, is going to have a lot of new jobs. Nursing care facilities, offices of physicians, and outpatient care centers. There are a number of factors that could affect the mix of settings in which nurses and other healthcare workers are employed. The most important thing is emerging care delivery models. Innovations such as patient-centered medical homes and home-based long-term care services and supports are likely to shift patients into more preventative care and more home-based care, and out of institutional care such as hospitals and nursing homes. Expanded use of health information technology, we hope, is going to increase the efficiency of care and also help improve our ability to provide patient-centered preventative care. And new payment models are going to provide incentives for hospitals and other care providers to improve the efficiency of the services they provide and to try to prevent rehospitalizations and adverse events. In early 2015, we'll be more actively exploring the potential of these things to affect the supply and demand estimate models that we've presented. Now let's talk about the next steps we should undertake to ensure an adequate nurse supply in California. We do have a significant challenge in trying to define shortage in California. We may look at the numbers and find that many new graduate nurses are finding it difficult to get jobs, but then we have to raise the question of whether current employment levels are adequate to provide the quality and quantity of care that we think we need in California. We're not sure if California should be employing nurses at the national average, the 25th percentile, or if it being at the bottom of the states is fine. We also need to debate economic demand versus need-based demand. We may think that our population would be more optimally served with more registered nurses, but if we can't afford them, we can't hire them. We also need to explore how the Affordable Care Act is going to continue to impact demand. It does seem in this economy that the demand for registered nurses is starting to ramp up again, but we have a reservoir of recent graduates who are still unemployed. In this environment, hospitals can choose to be picky and focus their hiring efforts on nurses with experience and look over the recent graduates who are unemployed. The problem that we face is that if RN education contracts, our supply is going to fall far short of demand in the long term over a 25-year period. So will recent graduates who can't find work leave California, or will they be able to hang in there until the jobs become available to them? And what can we do to foster opportunities for new graduate nurses to gain on-the-job skills and maintain their skills while they pursue additional education or do other kinds of activities or employment that helps keep them up to date and makes them able to serve our patients in the future? We need to identify strategies to retain new graduate skills and employ them quickly. And we need to help RNs continue their education if they want to do so. We have to have new graduates prepared also to work in non-hospital settings, because many more of them are finding themselves employed in nursing homes and other settings, which very much need highly skilled registered nurses, but nursing education may not be optimally designed to prepare them for these kinds of roles. You can keep up with our recent research on our website. This website is at rnworkforce.ucsf.edu, and on this website we will be posting our newest reports, demand data, supply data, education data, and other resources to help you keep track of the nursing labor market statewide as well as in your region. You, of course, should go to the Board of Registered Nursing website, but there is one trick to finding publications on their website. It's buried under the tab labeled Forms. So if you hover over Forms, then you will get the option to go to Publications, and on the Publications page you will find the annual schools reports, you will find the surveys of registered nurses that are conducted biennially, as well as the forecasting reports and other surveys and studies that have been done for the board. So available from the RN website is a list of the publications and types of publications here that I just described. So what's happening next? UCSF and HASC are continuing our collaboration. HASC is continuing to do quarterly surveys of human resources directors, and UCSF does its annual Chief Nursing Officer surveys. The next survey for Chief Nursing Officers will be sent out on October 1st or so, and we really do hope that those of you who are Chief Nursing Officers on this webinar will participate in the survey this year. This year we promise you that we will get the report out faster than we did this past year. We had some technical challenges with the way that we were trying to align the data between HASC and our CNO survey with respect to different hospitals reporting that they were providing data for a broader set of units in one survey than in the other survey. We put a lot of work into making sure that the data were aligned so that we could present as fair and representative a portrait as possible of what's happening in the RN labor market. The 2013-14 BRN Annual School Survey is also going to be sent to deans and directors in October, so you know to watch out for that. And the 2014 Biennial Survey of Registered Nurses is now closing data collection, and the report should be published in spring 2015, with new forecasts published in late spring or early summer 2015. And finally, as I said, the 2014 Employer Survey is being sent in October, so watch your email. Thank you very much.